Hello, BIRTHFIT. Dr. Lindsay Matthews here, your BIRTHFIT founder and CEO. I'm going to do my very best to share a 10-minute video with you for Breech presentation. So let's get on it. And hopefully by the end of this video, you have kind of an overview, some tips that you can start to implement, and maybe even some things to think about. So what is Breech and why is it an issue? So in simplest terms, breech is when baby is booty down inside the pelvis and not head down. Ideally, by full term, baby is head down with their spine anterior. If their spine's posterior and head down, that's fine, but it might present a little more back labor. So we want to get baby anterior if at all possible. But breech is when booty or feet are down, not head down. All right, so why is that an issue? So back in 2000, there was a study done, one study, and that one study, the term breech trial, influenced basically everything. Vaginal breech births stopped getting taught in universities, so our OB-GYNs and our midwives they stopped learning how to do vaginal breech births, which is really unfortunate. It's a beautiful skill to have, and there's still some amazing providers across the United States that have those skills, and hopefully they will pass that on. So that one study influenced a lot of policy, a lot of regulations. Midwives were in some states no longer able to deliver vaginal breech births, and it was just really unfortunate because since then that study's been looked at and considered flawed. And if you want any more on that study, go watch the documentary Heads Up that my colleague and mentor, Dr. Berlin, put together. Heads Up is the name of it. So, all right. So, BIRTHFIT, what the heck? We are a company that specializes in holistic training programs and basically a connection with yourself and awareness and movement, sustainable, efficient movement. And at the most basic foundational level, we start with some things called the BIRTHFIT Basics. These are a set of 15 poses and movements that are designed to enhance the efficiency of your training and explore range of motion. And we'll get into some of those in a minute, but basically what I want you to think about is these are like your vitamins, these are like your supplements, and you've got to do these daily or 5 times a week, because this movement is about having a conversation with your body and figuring out what's going on with your body. And we don't learn movement by just reading, oh, okay, squat, it's in my body, or lunge, got it, it's in my body, or hip range of motion, got it all. No, we learned by doing. We learned by actually moving through or performing that movement, that motion, so that our body communicates via our nervous system, hey, I feel safe in this squat, or this lunge feels good on this side, but maybe not so good on this side. What can I do? So it's really important that we embrace movement and range of motion and have control throughout that range of motion and that movement so that we feel safe and it's in our tool belt so we can pull it out during labor and delivery. So about 10 to 24 weeks during pregnancy, baby is getting in position, and I won't call it final position, but they're just figuring out what they got available to them, and they're exploring that, and they're finding basically what side they want to lay on, what side feels the best. You, the birthing person, we are doing our best as the birthing person to set up an optimal environment. And this, yes, it means mindset and connection and energy and all this stuff, but on the most simplest terms, it also means like surface area. So how much space does baby have to move around in? Like, do you have a chronic hip thing on one side? that's going to influence the surface area and just cause baby's only going to move over here. So think about that. You got to get sorted. You got to get your musculoskeletal system sorted, your nervous system connected to, turn the lights on. You got to get all that addressed and maintained throughout pregnancy and postpartum. So 10 to 24 weeks, baby's moving around. They're figuring out what kind of space they got. And ideally, you, the birthing person, are moving around too. So some tips. These would be my tips to start as early as 10 weeks, ideally preconception or sometimes first trimester, but 10 weeks, let's go. So chiropractic care. Chiropractic care, in the simplest terms, is connecting with your nervous system via your spine and via your musculoskeletal system. And this is one avenue to facilitate that feeling safe in certain movements and basically healing chronic stuff that's going on. So start getting regular chiropractic care. This will help to balance out the pelvis and to really open up the pelvis and make sure everything's in alignment. The other thing I would say would be walking. So let's go back to the pelvis. Right here, these SI joints, which your chiropractor will address, they're only designed to move maybe 4 to 6 millimeters at the most. But when we walk, boom, boom, we're going, that's like an exaggeration. Walking enhances circulation, it's going to enhance all that blood flow, and you're going to deliver nutrients and oxygen and wonderful things to, let's say, like the disc of your spine. Isn't that a yummy thing? But it's also just going to keep shifting and shimmying with baby. You know, not get them locked up or comfortable just predominantly on one side. So walking, I would say 1 to 3 miles a day would be ideal. Maybe 1 mile in the morning, 1 mile in the evening. Yeah, there's 20 minutes, good to go. All right, and then the BIRTHFIT basics movements. So BIRTHFIT basics, 15 movements and poses that are designed to enhance the efficiency of your training and designed for you to have a conversation with your body, to just say, hey body, what's going on today? And to move in different planes of motion. We don't know what plane of motion birth is going to happen in. In fact, it happens in all of them, and it demands all your energy systems. So if we stay in the sagittal plane of motion, that, like with training and moving, that's not going to be ideal. But anyways, BIRTHFIT basics, so things like happy baby, dead bug, even tabletop and segmental cat-cow and bird dog, and then high bear, hip range of motion. All of those are part of the BIRTHFIT basics, and those are all really yummy movements to help with baby position and birthing person position for birth. So let's say you've done none of this and you're like 26 weeks. Okay, great. Sometime between 26 weeks and 34 weeks, that's when the final position gets determined. And yes, babies can flip and miracles do happen beyond 34 weeks, but you know, baby grows and they run out of movement. So if you're in this window of 26 to 34 weeks, let's make all of this stuff happen on the reg, like chiropractic care, walking, high bear, inversions, like let's make it happen. So one of the first movements we love is, I'm gonna move that camera, is tabletop. And you'll see this in the BIRTHFIT basics, and you'll see it programmed in our prenatal training, and we program it in certain weeks for a reason. But tabletop, boom, wrists right under our elbows, knees right under our hips, and here you can do a lot of things. You can move around in tabletop, you can move in circles, you can move side to side, whatever that looks like, feels like, it's whatever. You can also play with the tilt of your pelvis here. Anterior tilt, posterior tilt. Anterior tilt, posterior tilt. You can also do segmental cat-cow, which we love. And we start with the sacrum and work up the spine one vertebrae at a time into global spinal flexion. And then we go into spinal extension one vertebrae at a time. And sure, this is going to look a little different. Range of motion is going to be cut off just a little bit. But the intention of moving each segment one at a time is key. Whew. So that's tabletop. And I want to touch on just a minute pelvic tilts. So anterior tilt, posterior tilt. If we think about the posterior tilt, boom, we are opening up the pelvic inlet and inviting baby, saying, hey, there's a little bit more room. Let's say if you're sitting at a desk job or you're sitting at a computer for majority of the day, set your clock, set a timer, and get up and do 20 pelvic tilts every hour. Do those with some tabletop stuff or some high bear. So yeah, moving on. The next thing would be a high bear. And you can start in tabletop and then move up. So we're here. And in high bear, pelvis is above your rib cage. And we got ideally a spinal neutral going on. And we can play with the tilt of our pelvis here. And after I spend 10 breaths here, I'm going to come back down and I'm going to go all the way vertical. This is really key, the vertical position after your inversions. So high bear, and I'm going to show you a forward leaning inversion. You want to get vertical after those. So that's high bear. All right, forward leaning inversion, or if you're comfortable doing handstands, like those are fine. But I always set up to have props around and advise people to have props because it's easier to get out of. So you're here, and then you find a really comfortable position. I like to put my head on the ground and have my hands here. And then I'm just going to take 10 diaphragm breaths like I would in tabletop or high bear. And then to come out, this is where you want some props to push yourself back up. And again, vertical position, rib cage on top of pelvis for a few breaths, and then you can sit back on your heels or in a more comfortable position. So, yeah, we talked about a bunch of stuff. Things you can be doing: chiropractic care, BIRTHFIT basics, specifically tabletop, hip range of motion, high bear. Happy baby is a good one to really open up the hips. Squats are good. Oh, I forgot to show you this. So squat therapy. Yes, we can lift weights and do things with squats, but if you're not comfortable in the bottom of a squat, use something to hold on to get comfortable, because in the very bottom of the squat, you can play with the tilt of your pelvis. And you can hardly see it, but you see my hamstrings activated or activating. It's a really, really good thing. So getting comfortable in the bottom of a squat. All right, and all those are BIRTHFIT basics movements. The other thing I would say do is to visualize. Spend some time visualizing your baby head down and talking to baby, saying, hey, it's okay to go head down. I'm supporting you going head down. I'm giving you permission if you want, if it's safe for you to go head down. That's some really powerful stuff. So ultimately, baby may know something or see something that we don't see on the outside. They might have a reason for staying breech, and maybe that's how they want to be born. Who knows? Babies are born exactly how they want to be born. So what I want you to think about, especially if you're 35, 36, 37 weeks and babe, you've done all you can. You've set up this optimal, beautiful environment for baby to move around, explore, and they're just booty down and they're just presenting and booty down, being stubborn, and that's okay. You'll probably see it in their personality on the other side. But you've done all you can and baby's still breech. So what are your options? Well, vaginal breech birth or cesarean birth. And these two might not have been the birth you desired at all, and that's okay. So you might have to mourn the birth and like grieve the birth that you desired, and then start to wrap your head around these two options. And I've seen beautiful, beautiful birth experiences for either of these two options. And for a vaginal breech birth, you may have to switch providers. You may have to find a provider that does vaginal breech birth in your area. And if you need referrals, definitely reach out. Or if you have somebody that you're like, okay, I'm gonna go the cesarean route, I would encourage you to explore the cesarean with spontaneous labor, because then you know baby is ready. And there's tons of providers that will support your desires in that choice.